Yay! So I'm saying this because when this fellowship started, I would have never said such a thing. I think my perception of leadership was linked to the beliefs and the culture and the tradition, the society where I grew up. And it somehow looked like you need to be a medical doctor, to have an MBA, to have gone to a prestigious university, to have a surname of an influencing family, to be tall, to speak English in a way that is very eloquent and, beautiful English, not the Colombian English. And so somehow that has triggered a lot of doubts in my head of how far can I make it. In a context where going abroad for the majority of people means taking less qualified jobs, it was impossible to dream of doing something of greater impact. So when a couple of years ago, I was given increased responsibilities, the first thing that came to my mind is there was a recruitment mistake here. And they got it wrong, or I was the easy option, I don't know, something was wrong. And I think my first reflection about this year has been the gift of recognizing, revisiting the value of authenticity and courage. And for me, authenticity meant lifting some facades. I remember in one of the first convening, Jose asked me like, "Oh, you look so serious in your picture. You're actually kind of funny. It's nicer when you smile." And I think it was linked to that image I felt I had to project. And this year has been a gift for me to be able to meet and to exchange with each of you, to accept that with less size, with a Colombian English, I could also be myself and bring my whole version to work and to everyday interaction. So as many of you know, this year I became the father of a little baby named Aman. And this has been one of the most transformational experiences for me. This came with an overwhelming sense of joy, of love, of responsibility. And, but also it came with a number of feelings that I didn't expect. So a very intense sense of anxiety and fear of anything negative happening to my child. Is he breathing? What do I do if he is not sleeping well? Should I go to the doctor already? There was a series of like panic attacks around that. And suddenly the work that I had been doing for a number of years took on a new meaning. For the first time, I could vividly imagine the pain and suffering of parents whose children are affected by illness, whose children are having a rash, whose children are paralyzed, unable to move thanks to disease, whose children are not able to breathe due to pneumococcal disease. And there was this feeling inside of me that gave a new sense to the work that I do on a day-to-day basis. However, as you know, I have the chance to live in Switzerland. I feel fortunate to have access to a strong healthcare system where my pediatrician told me about vaccines, where vaccines were available, where every time my child has been ill, there was a place I could go to seek quality of care. Sadly, this also made me a lot more conscious of the fact that in my home country, Colombia, there are many areas where this is not the situation. And in many other parts of the world, including in some of the countries that you represent here, it's not the case. In 2023 alone, more than 1.5 million children died of diseases that are vaccine preventable. This is almost a third of the population of New Zealand. Yet, in countries in Africa or in Southeast Asia, 1 out of 5 children remain unprotected from diseases that are out there. I often ask myself, why are some people lucky enough to have the chances that I had? I see no merit on having born in a family where there was a shelter, where there was food, where my parents were able to offer me opportunity of education. I did nothing to have the opportunities I've had. And I think this question, this self-reflection, is what brings me to my vision of health equity. And it is a vision of a world where every child, regardless of the places where they're born, of their family's income, of their gender, has the opportunity to thrive. I'm honored to work for an organization that has, this is called Gavi, the Vaccine Alliance, and that has a very simple yet very profound mission, which is to increase access to life-saving vaccines in the world's poorest countries. It breaks my heart when I go to a number of countries and I hear about vaccine hesitancy, when I hear parents not convinced about whether I should give a vaccine to my child. Throughout my work, I've been able to visit the places where these diseases are present, where many children die of these diseases, where mothers want help to protect and save their children, yet the issue is that they don't have the option because vaccines are not available. Supporting this mission, so I've been supporting this mission in a number of countries. You have heard about some of my stories in countries like Pakistan, in Mozambique, and most recently in Burundi. And I must say I have over and over had the opportunity to witness the power of vaccines. And I want to reiterate this to you because I would like that out of this cohort, we already have a group of ambassadors for systemic kindness. And I would like to count on you to be champions for vaccination amongst your friends and your communities. So I've been able to witness the power of vaccines to reduce burden of disease. It is very clear when a vaccine is available, the burden of certain disease has decreased dramatically. And when children are healthy, they can attend school, their parents are not suffering with the expenditure or are not required to stay at home to take care of them. Their families avoid catastrophic expenses, and they can envision brighter futures. Therefore, vaccines are more than just a healthcare intervention. In many countries like Burundi, like Mozambique, vaccines are a lifeline, are a stepping stone to the country's development and future. Now, my organization was founded to address vaccine access inequalities. Since the mid-1900s, there has been a rapid growth in the number of vaccines. To date, more than 60 vaccines are licensed, and we have vaccines that can prevent more than 30 diseases. However, initially, these vaccines were only available in developed countries. They were too expensive, there was not a market, it was too difficult to register these vaccines in country by country. So while over 75 low-income countries have made progress thanks to our organization's support, have introduced new vaccines, there is a lot of work that remains in reaching every child in these countries. My role at Gavi involves coordination, collaborating with ministries of health, of finance, with technical and expanded partners, with civil society and organizations towards driving this mission of ensuring that every child is vaccinated. However, let me share an anecdote. Once, a few years ago, I was in Pakistan. My boss was giving a presentation about Gavi's strategy and our coverage and equity agenda and our new investments in cold chain optimization platform. And I had Dr. Sofia, who was the immunization manager, sitting next to me. And she tells me, Mario, you guys are funny using all these white people's words. You will have to tell me later what this means. Equity, optimization platform. Are you talking about more fridge and more vaccines? Why don't you just say it that way? And I think that was the moment where I realized that my job was beyond a simple coordination or representation, but I saw my job as a translator. My role shifted to translate Gavi jargon and high-level policies developed in Geneva into words that can be explained to someone in a health facility, to the colleagues in the Ministry of Health, that could be tangible, translate into the impact that we wanted to see. And the other way around, my mission was to ensure that the real needs on the ground will translate into the streams of Gavi support. So I came to this fellowship. I signed up for the Atlantic Fellows for Health Equity program with a wish of becoming a better translator. I feel I've spent a number of years working in immunization, yet I think I was missing some other aspects of the picture. And this amazing program came up with the promise of helping me understand the foundations of inequalities and to gain some tools that I could add to my toolkit. And so we did. So we spent a year where we learned about disparities in maternal health care. We learned about environmental health and how it impacts disproportionately communities. We heard about the role of gender and education and how it affects vulnerable populations in specific ways. And through each of these sessions, I feel like I was connecting the dots about how each of them speak to the work that I do, by tackling and understanding those disparities and learning about solutions that had worked before, I could do a better work once I return. And for that, I have been very grateful. As you know, I was on parental leave for the majority of this period. And I feel really bad about it because you were all really in the field. You were very busy, struggling, and I was with my baby, and but I felt I was missing out on something. And I first of all wanted to thank the program and all of you for showing me as well that you could meet me where I am. And this is the time that I could take for reflection, for intentionally learning from your experience, and for recharging my batteries for the moment to come. So I came back to work a few months ago. I'm like, guys, how did you do this? It was totally crazy. I couldn't do my homework. I barely could join the calls. But I was back to action, and I felt in the right place with better tools. I wanted to share a story from Burundi. So now I'm working with Burundi and Mozambique. And last month I had the opportunity to visit Burundi, a small country in the Eastern Africa region, highly dense population, known to have one of the lowest gross net income in the world, but also a beautiful place. Neighboring with Rwanda, where we all had the opportunity to share. It shares the hills, the greenery, and the smiles of the people. It also has hippopotamus walking on the street, which is very nice. But during this visit, I met with a group of community health workers, since I was very keen to learn about how immunization works, what are the issues they're experiencing. And I met with this woman called Odile. And Odile was a strong, smiley woman, so proud of sharing with me about the work that she does every day. And guess what? Since I have already learned about the community health worker in Rwanda, thanks to this experience, I felt so equipped to ask the questions, to compare about what were the differences, to understand some of the gaps. And so she was very proud of telling me what her day-to-day looked like. Contrary to Rwanda, she had a very large number of houses to visit. She would tell me how her role was around informing or teaching the persons living in her community about essential health practices like hygiene, like nutrition, how she would know how many children live in each house and which ones are due for vaccination. She will remind the parents whether your child is due for the next vaccine on their schedule. She would also report whether there is a child with fever or somebody has any symptoms for malaria and facilitate their rapid response. And this was a beautiful presentation. Over the break, Odile came to me. And I asked him more questions. So tell me, how many children do you have? Do you also have a job? And she showed me the other version of the story. She told me how exhausting it was and how she was unable to complete all the houses that she had to visit just because some houses were on the other side of the mountain, just as we saw in Rwanda, but also because she had too many. How she didn't have the resources and the medicines required or the diagnostic tools. And something that touched me very much is when she told me, we are not fairly paid, but when we get paid, I have to give half of my remuneration to my administrative supervisor, which was a sign of corruption in a system that was not placed like this. And that was one of the moments where I thought of what can I do and what is my role as someone coming new to this country. And the famous, if not me, then who? If not now, then when? I kept asking, why? Why? Why is this problem? Why do they have so many houses? Why are they not getting paid? And then I was reminded, perhaps something that I forgot over the months I was out of work, and is that some of those problems are incredibly overwhelming. They're huge, they feel complicated, one person cannot solve them. There are government structures, there are health systems structures that feels bigger than ourselves, and sometimes this really shut us down. However, listening to Odile remind me of my own responsibility to be that stepping stone to a step of change. And I think I've been inspired by the work that you do, by the resilience of this group, by your stories of beating the odds, of going beyond expectations. And I came up with I think it reiterated the sense of urgency for us as donors and as partners that I was meeting for the first time to prioritize this work. So I'm just happy to report that we have initiated this month a review of the community health workers strategy, and hopefully we will be able to address or to give a new direction to this initiative. But I think what struck me the most was Odile's courage. Courage to do the right thing, even when it was unfairly paid, even when it was unfair, the fact that she had to share her little income and the conditions were not good. And so I think that remains a source of inspiration. And today I want to, first of all, celebrate you all as part of my journey, but also urge each of you to continue finding the courage to take that first step towards change. I think in many of our specific roles, the problems we face might feel overwhelming, too big, too complex, too entrenched in the systems we know. But remember that change is possible, even if it seems impossible at first, that it takes kindness and one step, one act of courage, one voice, one person stepping up, uncomfortable with the status quo and simply not doing anything. So I think, just to close, I would say that this fellowship has strengthened my commitment to vaccination and to health equity. through learning, through all the sessions, what we did this year. But something that has been key as well has been unlearning about, or shedding kind of the assumptions and the beliefs that made me feel that I was not in the right place and that I was not the right person to do the work that I do. So thank you. And I'm very much convinced that together and with the people of this room, we can lead the change for a healthier and a fairer world. So thank you very much.